Welcome everyone. Welcome to the third session of NatHealth Leadership Reach Out series for our frontline health warriors. I'm Anvesha, Deputy Director at NatHealth. The pandemic has had devastating effects on all of us and also has stretched our healthcare systems and especially our healthcare staff and frontline workers. There's an urgent need to address the wellness of the healthcare frontliners. They have been the strongest workforce in healthcare and have helped us in managing the pandemic so far. They are warriors in true sense as they are at the forefront of the war, saving our lives. But they are now facing vulnerable times with stress, mental breakdowns, physical exhaustion, and have little time for personal life. To help our frontline warriors, NatHealth has initiated this series. Every week, a select group of healthcare leaders and mental health experts will speak directly with our warriors. Today, we have an eminent speaker, Mr. Gautam Khanna, with us. A very warm welcome to you, sir. Mr. Khanna is the CEO of PD Hinduja Hospital and MRC Mumbai and is also the head of Hinduja College of Nursing. An experienced business leader with rich experience of more than 30 and a half years of successfully managing diverse business and creating sustainable shareholder value in domestic and internationally challenging environments at Hinduja Hospital across APAC, Latin America, USA, and in India. Prior to this role, Mr. Khanna was the executive director and country business leader of 3M Healthcare Business for South Asia region and worked in 22 years in India and abroad. Mr. Khanna is also an active member of various leading industry associations. He has held the position of the chairperson of FICCI Medical Device Forum, co-chairman of AmCham Medical Device Committee, chairperson of India Working Group, AdvaMed, and secretary of NatHealth. He is the national leader of the Service Provider Forum at NatHealth. Currently, he's also the co-chair of FICCI Health Services Committee and president of Association of Hospitals, Mumbai. Mr. Khanna is an alumnus of IIT Kanpur and IIM Calcutta. A very warm welcome to you, sir.
Thank you, Anvesha, for the nice introduction.
Okay, so today's session, we would basically be focused on how to cope up with the stress, which is building day in and day out for our frontline workers, and how can we keep them safe and their families safe during the pandemic. So with this, moving on, my first question would be, the current systems, and if you look at the current systems, our staff has been overstretched at the moment. So what initiatives you have taken, sir, as the CEO of Hinduja Hospital, and what would be your advice to other hospitals on any good practices that you have initiated?
So Anvesha, before I answer you, maybe I just give a 1 or 2 minutes little background. So for the people who are watching, so we all know this, that our second wave has hit us harder than first wave in many aspects in terms of the number of people affected, and it has touched the lives of many of our our close relatives, friends, family. So this is a little different from wave one, where we were in last year we were struggling. We didn't know what the disease was, we didn't know what the medication was, we didn't know what the infrastructure was. But last year the challenge was on those aspects. But having said that, I think the healthcare industry and all of us cope with it very well. I mean, we've done the changes, we developed the protocols, we've done things to manage the first wave pretty well. And if you go back to the history of the pandemic flu, the Spanish flu in 1918, the first wave subsided and the second wave hit them hard. And I think that was a lesson. And I remember the discussions among the healthcare professionals that second wave will hit hard. But the average people didn't accept that. They just believed that it is going to go away or it has gone away. And I think that is a mistake, that all of us let down our guard. And whether we blame the government or the people, it's just that all of us are collectively in this together. I mean, people started going out and eating out and meeting people and crowding and so on. So I think the second wave is more because of people's laxity, that they have not taken adequate precautions. So having said that, I have to say that in the second wave, the issues about medications which were sorted out, by scientific evidence and journals and so on, have are prevalent in the hospitals. But now, since the wave has spread to towns and smaller towns and cities where larger hospitals are not there, there is a little bit of less understanding of the treatment protocols and the medication. So we find that many people are prescribing a lot of medication in the first week, which the doctors say that there is a limited amount of medication you need to give, and so on and on. So I think that is one thing. This is just a message for the people, that please look at scientific evidence and what are the protocols before you decide medication. Now, coming to the healthcare workers, we know that in this pandemic, all the healthcare workers, whether they were frontline staff, admission billing, whether they were cleaning, whether they were doctors, nurses, procurement, engineering, everybody was stretched, and stretched in multiple ways. For example, they had to do extra work when there was lockdown and there were resources not available. Plus, they had to come to a hospital which has COVID infected cases, and then they have to go back home where there is a family and they have a risk of infecting parents and children and their family members. So it is a quite a stressful time, and it continues to be so. So now I'm going to answer you in two ways. So first is on the operational side of the matter for the hospital operations. So we initiated this last year about that there is a daily meeting of clinical and non-clinical separately, which talks about the previous day's issues with various heads of department and people concerned, and then sort out the issue, take the decision, and just move with it during the day. The protocols have been implemented based on the evidence and the clinical expertise of our doctors who have talked to national, international experts. So we are quickly implementing. And then we are flexible that if we know that we implemented something and there is new evidence, we change it. And I just want to say that people need to know that whatever changes or whatever protocols to be done in the hospital, it needs to be absolutely science-based, based on the clinical advice. It cannot be done based on what others are advising you to do based on their protocol. Now, our people. So like I mentioned, so people are stretched. They are stretched physically, emotionally, mentally, and spiritually, if I can say so, because there is so much negativity around. So what we did, we last year around August, September, I think July, August, we launched a program called Sampark. Now, Sampark in Hindi means contact. So Sampark comprises of different aspects. So one aspect takes of physical well-being of the people. Second takes care of the mental. So in physical well-being, we do some online exercises, teach them about some physical activity, and we do walkathons and some things like that. So people are active physically, contests. And then we do some emotional. So we have to take care of the emotional health in terms of we conduct some music competitions and some antaksharis and things like that, and just basically connect people. For the mental, we get them involved in quizzes and so on and on. And then also we have a 24-hour helpline with our psychiatrists. So there are 3 psychiatrists who are available all the time, every day of the week, and our healthcare staff can reach them anytime. And many have also reached out. Of course, it's confidential. We don't ask them who has reached out and what, but we know that many people have reached out. So I think that also gives them the benefit. The other thing we do is that for the spiritual aspect, we have every Thursday, we have a meditation of Twin Hearts in the hospital. And on Monday, there is a prayer meeting. So people are free to join. And so it's happening. So, it is obviously it is not something which takes care of everything, but it is just a step from the hospital side to tell the people that we are with you together, and we'll take care of your all kinds of health. But another thing before I give it back to you, Anvisha, I think one thing which our staff has really, it has really helped the staff. I think it is the duty of the leaders to communicate properly to the staff why they are doing what they are doing. It is because people are not doing this as a job. If you do it as a job, then you will be demotivated within a day because there's too much effort and too much negativity. But our people have understood that they are doing it for a higher value of serving the community, helping the humanity now at this time of crisis. Like we all say in our hospital, if we don't do it, who will do it? And it is our duty, and we are doing God's work of helping the humanity. So I think when the people understand this, many of the challenges which they face of day-to-day stress, they can't forget the stress. And I don't tell anybody to forget the stress, don't fight it, but please learn to cope with it. Manage your physical activity at home. Just do some physical exercise, 15 minutes, half an hour, anything. Just be at home with your family. These are small things which are necessary, along with the programs which we can do in the hospital. I think it's a little long answer, Anvisha, but over to you.
No, this is great. And I really liked your initiative of Sampark. I assume the other people who are watching, our viewers who are watching this, may take notes and, start something similar in their premises as well. So moving on, there has been limited infrastructure. By infrastructure, I mean, there's been limited supply of oxygen, beds, and, the hospital staff is anyways overstretched. And then they have this guilt feeling because doctors are also the frontline workers or healthcare fraternity. They're also human beings. So they have this guilt feeling of not being able to save everybody, right? There have been heartbreaks from doctors, from our hospital staff as well. So how do you think you have been able to cope with that sort of stress?
It's true. And I can tell you at a personal level and at the organization level, all of us are facing this. I mean, I feel helpless when I cannot help some people whom I know or people who come to me for help across the country, and we cannot help them despite being in the healthcare industry. So we feel quite bad. And our staff and all the people in the organization feel very bad when they are not able to save somebody. But the way to do this is, like we say, we need to try our best. And we keep saying that as long as you have tried your best to help, and then you have also saved many people. So, of course, the one person you could not save, for them, life has been devastated. But at least you have saved the other 99 people. And I think people need to get on with the positive attitude, because in this crisis, only the optimism and positive attitude will take us far. And the thing about this pandemic is that we know that this crisis is there, and it can hit anyone, anywhere. So unless we are positive and do what we can do in our limited ability, if I can reach out to a friend to help, if I can help the patient in the hospital a little extra, if I can be a little more empathetic, I should do that. And I think that is what all of us need to imbibe.
Yeah, very well said. And this is very true. So as you said, that, this virus will spare no one, and, it can actually affect anybody. And so our healthcare workers are also being affected, they also get infected. So in those situations, one, there is this scare that they might get infected and they could infect their families. So what steps you have taken in your hospital, or what advice you would give to the frontline workers to save their families from the infection? And if they are infected, what they could do?
So what we have done in the hospital is that as per the infection control guidelines and our infection control expert, we have identified different areas in the hospital, which are green, orange, red, yellow zones. So depending on the zone, the level of PPE and the infection control has been advised. So that there are some places where you need to have full PPE. There are some places you need to have N95. There are some places you need to have an N95 and a gown. So that has been told. And we have always been erring on the side of caution. So if the guidelines say you do X, we do X plus one. So what we tell our workers is that don't compromise on this. There is no compromise. We know it is uncomfortable. We know it is not, people believe that nothing's going to happen to me, but we know that. But, we enforce it. In the initial days, we were enforcing, we were looking at, camera pictures, we were pointing out to people, we were telling people. So initially the compliance was a little low, but immediately it picked up. So now compliance is there and people understand that if they comply to the infection control guidelines, they will be safe. Now the question is, they are safe in the hospital, but what happens when they go home? They go in a bus, on a train, or in a taxi, whatever. So we have been telling people that how to manage the masking, how to manage the guidelines at home. So that has been happening. And despite this, some people still get affected, right? They go to the neighborhood shops and, there are lots of interaction points. So for that, all we have to do is that if they have places to isolate, sure, please do isolate at home. If they don't, we have a separate facility where we provide isolation facility for our staff, because so they are not so severely infected to be part of the to be admitted to the hospital. But for us, if they need admission, we'll provide admission. But if they don't need admission, isolation, we provide isolation. And then we have for patients, what we have is the COVID care at home package, where our doctors look after them for 14 days and nurse monitors their vitals every 8 hours. And there is a counselor, there's a dietitian. So those services are provided to our staff too if they are at home isolation. So that's done.
That's very well said. So thank you for that. My next question would be when the new strains are coming up, how do you think we can cope with the virus? The virus is reached in rural areas now, where the infrastructure is not that great. In fact, there are very limited hospitals out there. So how do you think, or how much we are prepared to control the virus in those areas? And how would we be able to do that?
I don't know how much we are able to control in the rural areas. So I cannot say that. Mm-hmm. But all I can say is, yes, there is a shortage of infrastructure in the rural areas. And sometimes the physical infrastructure exists, but it needs to be ramped up a little bit and maybe, maintained properly. And the doctors and nurses need to be provided. So what we can do is, of course, the protocols which have been agreed in the urban areas need to be quickly percolated down to the rural areas so that a regular GP can take care of them. Plus the companies, I think companies have a lot of CSR money. So that this is the time to spend the CSR money and build maybe oxygen plants, maybe give ventilators, maybe give other equipment to the rural hospitals to ramp up their infrastructure. And sometimes many people think, oh, now they don't need, the second wave has passed. It doesn't matter. Please give it, because we don't know about the third wave. And in any case, it's not going to go waste. Rural India still needs healthcare infrastructure. So I think that should be done. And in addition to that, people like us who are in the urban areas, we can and we should provide, like, for example, remote monitoring, if we can monitor the ICUs from here. And in any case, we have the video consult packages. So people who are isolated and being treated at home, currently also many of our consultants are treating patients across 260 cities in the country. through teleconsult. So it is happening. But if they need to be admitted to a hospital, then they need to go to a hospital. And then if there is a need for ICU monitoring, then if they don't have the capability, then they need to tie up with the nearest bigger hospital and get some kind of a remote monitoring done. So there is not an easy answer to this, that within a few months or a year, we cannot ramp up our infrastructure 10 times. It's not going to happen. But we have to do all these efforts and maybe it will help.
Yeah. So very well said. In fact, the CSR piece that you mentioned, that's actually great. Remote monitoring piece also. That is what is advisable at this point of time. So great answer. And thank you for that. The second wave has hit us, and it has hit us really hard. And there have been talks going on that the third wave would come, fourth wave can also come. And in some countries, it has actually. So what do you think? When would third wave hit India? Do you think we know exactly when it will hit us? And what about the fourth wave? And what will be the impact of it? Do we know that? So I'm just asking as a naive person, right? Because these are these questions which have been floating on our from the frontline workers, and that's I thought that I just picked those questions and I thought, yeah, because I also resonate in that. Those questions.
Understood. But whether some people say third wave will come, but it is the nature of the virus. It will mutate. It will mutate. It will spread. That's what viruses do. But whether the third wave will be worse than second wave, whether it will be less, we don't know. But I think what we can do, and all of us, whether it is healthcare people or the community, we need to just be ready that the third wave will come. So whether it comes in July, whether it comes in December, doesn't matter. We need to continue to do our COVID appropriate behavior in terms of social distancing, masking, hand sanitization. I think that cannot be compromised, irrespective of whether the third wave is going to come next year or this year or 3 months later. Let us not wait for that, because if we don't do COVID appropriate behavior, we are going to just advance the third wave earlier. If it was supposed to come in December, it'll probably come in July if we are not careful. So I think we need to be very, very careful. And who knows, with the appropriate behavior, we may not get this third wave and may not be so worse. But in addition to that, I think the request to all the hospitals is, and all the leaders here, is we need to understand the third wave may hit. I'm not going to say will hit. I'm saying may hit. So whatever infrastructure and protocols need to be ready, we need to keep them ready now. Now, whether we will use them or not, I hope we never use them. But we need to get ready now. And our duty as hospital providers, healthcare providers, as hospitals, is to be ready and hope that we never use the infrastructure. But don't hope that it is not going to hit us. Yeah. That's the only answer I can give.
So we have to keep on taking precautions, masks, sanitizers. That is what it has become the new normal now. So, the virus has been moving really fast and mutating itself. So how do you think we can move ahead with the virus, and what exactly could be the training needs of our frontline healthcare workers so that we are better prepared and we move ahead the virus?
See, for the healthcare workers, I think the first thing needs to be done is somebody needs to communicate to them the latest scientific knowledge and evidence that this is what has happened. For example, we heard many things about plasma, and then now we know what is the efficacy and so on. So same thing about plasma, same thing about HCQ. So it's important to be aware of the latest scientific advances and research and evidence. So that is first thing all the healthcare workers need to do. The second is, I think, take all the feedback very, very positively, because when the patients, and this I'm saying to the staff which is in the hospital, the patients are alone in the hospital in times of COVID. They have no family. Then the only people they see is the healthcare workers. So the healthcare workers need to be a little more empathetic. And they are, but they are also stressed out But I just want to reinforce that they need to be a little more empathetic. They need to be a little more, if they can connect more to the patients in terms of, whether they are following a process or whatever guidelines, just be with the patient. I think that will help recovery of the patient much better. So that is the other thing. Then in terms of whether they can be ready for the future healthcare workers, I think they just need to be, it's very easy to say from my side, but we've been working since 12th March 2020 every day. It's more than a year. Most of us in the country are working, and it is quite stressful. The the thing is to recognize that it is stressful and to deal with it, but not run away with it. And it will come again. There will be more, and we need to just know that it will be more and be ready with it. So that's some small advice for
Yeah, agree. So, so if I look at the second wave, there had been some instances and some challenges in the supply chain or management, especially in the second wave. So now that we have learned from the wave 1 and wave 2, what are the steps that can be taken to remove those blockades of the supply chain so that, we are better prepared for the third wave, if at all it comes?
Let's take a classic example of remdesivir.
Yeah.
Now, remdesivir, as per scientific evidence, even last year and earlier this year, they said it reduces the hospital stay by a couple of days. It is not a life-saving drug, and it has to be given at an appropriate time. So there are a couple of conditions with remdesivir. What did we find? That across the country, people are prescribing remdesivir, and one patient patient relative gets a prescription for a remdesivir. That fellow calls up Bangalore, Bombay, Jalandhar, Kolhapur. So the one patient has created demand in 5 places for remdesivir. So suddenly it just looks that it is short supply. And then I also understand the challenges of the medical professionals, that when the patient is not improving, the relatives are saying, what are you doing about it? What are you doing about it? They have read on WhatsApp that remdesivir is the wonder drug. So they are pushing the medical professionals to give the wonder drug, remdesivir. So the poor chap prescribes it. But I think going forward, we need to go only by the evidence. And the way it was controlled in Mumbai, that it will be controlled by the FDA, local of FDA, then there is no rampant search for remdesivir. It will be supplied to hospitals. It has to be given in a hospital. So if you're admitted in a hospital will get its a quota from the FDA. So I think some regulation is a must in that sense. But if you open it up completely, it is going to be chaos, because no country and no industry has the capacity to manage this kind of scale of demand. So that's the first thing. The second thing is, I think the second wave and first wave, especially I can say from Bombay, we've been involved in Bombay working with the government. There has been a lot of close interaction with the government, local government, and us, whether it is BMC, whether it is state government and the hospital association, with a close interaction, and we work. So we have supported them, they have supported us. We have, whenever there is a need by the government. So I think this kind of a collaborative effort needs to be there, and it should not be stopped now just because second wave is looking like it's ebbing. We need to continue that collaboration and keep control of operations, in the sense, how do you allocate the bed? Like there is a system in Bombay, how will you allocate the bed to a patient? So it's not that patient runs from one hospital to the second in the middle of the night. So you put a system in place. So I think the learning from the 2 waves is put the operational system in place from the government side and the local authorities side. Fix all the protocols from the hospital side. Look at your infrastructure from the hospital side. Go with the scientific evidence and then prescribe, and need some little bit of oversight and distribution of the drugs, which will help later.
Thank you for that. So, you mentioned that sometimes patients do threaten the doctor on prescribing something, and I'll pick from that. And I would say that I've also seen instances that where the hospitals have been attacked and there has been violence against those doctors, especially when they have not been able to save the patients. So, how do you think you were able to cope with that, and what would be your message to other
Nisha, this is
organizations?
very,
Yes.
yeah, this is very, very unfortunate. What has happened in some hospitals, and I'm aware what you're talking about. Hospitals have been targeted, doctors have been targeted, and I also understand that the patients, relatives are very upset when something bad has happened, untoward has happened to the patient, and patient has not been saved. But the fact of the matter is that the hospitals have tried their best. The doctors have tried their best. They are also working in stressful situations. So there are two things. So first thing is, one, I think we need to talk to the media and take the help of our media friends and spread the word in the community that what the community is doing, they are destroying the institutions which are helping them. So tomorrow nobody will want to become a doctor, nobody will be even working in a hospital. Then what will you do? Because you will destroy them, and you will completely demotivate them from doing their job. So I think that is something which our media friends can do. We need to also talk to some local NGOs and really talk about the issues in the hospital. So it's not that when most of the things happen because either the patient is not saved or the patient's relatives have decided not to pay. Now they have to understand that the expenses in a hospital are expenses because of the equipment, because of the drugs. So it's not going to anybody's pocket. So they try to save the patient. Ultimately, whatever happens is in God's hand. But the hospital and the doctors have tried their best. And I think this is just from the society and the NGO part of it. But I think one thing I need to tell on this forum, there is a law. The rule of law is that any violence against a doctor or a hospital will be is punishable by law. So I think we should try the softer things, but if it doesn't work, hospital needs to lodge a FIR and get the people who are taking violence or doing violence against the doctors and hospitals, lodge an FIR and let the police take action. I think it is very important because otherwise we will demotivate our healthcare community.
Yeah, totally. Thank you so much for that. You are with FICCI, you are with Association of Hospitals. So what piece of advice would you give to Nat Health? And with this, I'm coming to my last question. What piece of advice should you give to Nat Health on creating an industry-wide COVID response mechanism or something like that?
No, Anisha, I think firstly, Nat Health is in a unique position because this is the only association which has players from all aspects of the industry, whether it's providers, whether it's device manufacturers, whether it's equipment suppliers, the labs, diagnostic chains. Everybody is part of Nat Health. So I think this unique advantage needs to be applied into having a overall coordinated response from all stakeholders and talk to, like I mentioned, talk to media, talk to community, talk to the government, and give a response from the healthcare sector, healthcare ecosystem. I think that kind of effort will really go a long way. And this effort of Nat Health of reaching out to different segments in the country, and we need to recognize that healthcare is fragmented and there are many small players across the country. So this effort, whether virtually or otherwise, reach out to the players in terms of knowledge sharing, best practice sharing, this kind of seminars. I think this will help the overall awareness of the health issues in the country, and of course engaging with the government as a collaborative whole. I think Nat Health is anyway doing it. We can just do a little more of that.
Thank you. Thank you so much. Any last words of wisdom you have for our frontline workers who are watching the show?
No words of wisdom, just advise that COVID is not over. It has not gone away. Even if you see the second wave ebbing within a few weeks, please continue to take precautions and COVID appropriate behavior. Go with the scientific evidence, and things will, and with a positive attitude, everything will work out.
Sure. Thank you. Thank you so much, sir. It was wonderful to have you here, and you've answered all the questions so well. It has been really insightful to have you here. So, while I myself have benefited from your insightful answers, I'm sure our frontline workers who are watching the show will also be benefited immensely from this session. Thank you so much again. I also wanted to thank deeply from my heart the entire healthcare fraternity and our frontline workers who have been at the forefront. Nat Health expresses gratitude to all of you. We will continue the series, and I'll connect with you all on Friday with yet another inspiring leader. Till then, goodbye, keep safe, and take very good care of yourself. Many thanks.
Thank you.